Jamie, I'm so glad you came in today.
Oh,
Thank you
of
so
course.
much. Really appreciate it.
Thanks for having me.
So tell me a little bit about what you want to talk about today.
Okay, so ever since I was in junior high school, I don't remember when I started, but I had irregular periods. And I was told that because I was an athlete, that's the reason why it's not, a normal cycle. So I was like, okay, cool. So I just went with it. But now I'm 38 years old, it's really obnoxious to not know when it's going to happen. And so I was just wondering if you could give me any sort of tips about how maybe I could help, kind of get it to a regular, predictable cycle.
You came in and you showed me when you're having your periods.
Mm-hmm.
So you have that on your phone,
I do.
right?
I keep it on my phone, and every time I have a period, I write it the first day that it happens, and then I've been trying to figure out why, what, when, where.
Right, and so what I did was something I do in the office. I plotted out your periods for you. And I found that your cycles are actually normal.
Interesting. Even though they're different days.
Yes.
Or different amount of days.
Yes, so let me tell you, we consider a normal cycle anytime between 21 and 45 days. You range between 27 and 43 days. So you fall into the normal range, and a lot of times you're 30, 32, 37 is here, right? That's pretty close to skipping a month, but actually you are having normal cycles because only about, I think it's about 1 in 4, about 25% of women actually have a 28 to 30 day cycle. So 75% of us don't, and you fall into that normal range.
Well, that's very good, and I guess the doctors weren't lying to me all these years when they say I was normal.
Oh, so you've heard this before, but is this a surprise?
Well, they didn't really break it down like that. They just always told me, you're healthy, there's nothing wrong with you, things like that, so.
Well, when you first came in, I was thinking about all these lab tests that I would order on you if you were my patient, right? Because I would check your thyroid, because the thyroid controls every aspect of your body, including your menstrual cycle. And about 1 in 8 women will have a thyroid issue, and they'll have irregular periods. I do some thyroid testing, an FSH, which is follicle stimulating hormone, an LH, luteinizing hormone, and a prolactin, because the prolactin is a hormone that comes from the pituitary gland, and that can really mess up periods. And you told me already that you had had an ultrasound and everything was normal. So with this kind of cycle, what I'm seeing is they are unpredictable. You really don't know when they're going to come, but they're coming in a normal range.
Okay, that's good to know.
That's good to know. But maybe I can help you with a few other things. So for a lot of my patients, I would say if this bothers you, you have 2 good options. One would be the birth control pill, which I know you don't want to take, but maybe I can reassure you on something. So the birth control pill really has no chemicals in it. It has estrogen and progesterone, which are the same 2 hormones your body makes every month when you have a period. But I know you don't want to use birth control pills.
Right, because it always made me gain weight, and I don't want to gain weight.
You don't want to gain weight. So, and a lot of people think that the birth control pill will gain weight, but since you've had your kids, the birth control pill has actually changed.
Okay.
In the past, we were using about 30 micrograms of estrogen, and now we're down to 10. So when we look at data, not just like my experience, but when we look at hundreds of thousands of women all over the world, weight gain is minimal or 0 when women are on the pill. So if you compare 2 groups of women on the pill, women off the pill, they both have about the same amount of weight gain over time. There's another option, though, that I could tell you about.
Okay.
And that is a progesterone-containing IUD. So the amount of progesterone in these intrauterine devices is so minimal, it doesn't go through your whole body. It just stays in your uterus. You still ovulate. It just doesn't allow the uterine lining to build up, so you don't bleed very much. So about 60 to 70% of women won't get a period on it. Do you have any questions about that?
That's interesting. I just find it a little weird to stick something up there and leave it there,
Right.
It's just, I don't know.
I know, right? It's kind of freaky to think about having something in there for 5 years that really works well. In my practice in Silicon Valley, I put in between 1 and 4 a day.
Oh, wow.
And the way I do it is I use a little paracervical block, so there's no pain at putting it in. We have over 25 years experience with these IUDs, and we know that, gosh, they're really effective, 99.9% effective in preventing pregnancy, but they also have all these cool non-contraceptive benefits like reducing periods, reducing blood loss so women don't get anemic with their periods. Jamie, thank you so much for coming in today. It was so great to meet you.
Oh, thank you. I appreciate all the information.
Well, I hope it really helps you. Thank you.